Welcome to this course called Transforming Your Approach to Chronic Pain. So, thank you for being here. My hope for you today is those of you who are living with chronic pain to leave with less pain, and those of you who are here for another reason to leave with less strain, less emotional, mental, physical strain. And this is the purpose and tool that Logosynthesis services us to help to eliminate pain and strain and also to leave us more energized, which we all need more energy. So, my name is Mary Bentley. I served at the bedside as a critical care nurse for almost 40 years, and I've been a certified Logosynthesis practitioner for the last 5 years. I specialize in medical trauma and chronic pain. I'm also a partner in Bentley Leadership Group, where we teach people about wellness and leadership in businesses. And central to my wellness work is I have created an online course about chronic pain designed to help people who are suffering with chronic pain to have the tools to self manage their pain with more autonomy and to heal. And so I have a question to ask of you, and we're going to put this on a scale of 0 to 10. How familiar are you with logosynthesis? I want to get a feeling for the group. So 0 is I'm brand new, don't know a thing about it. And then 10 is I'm a practitioner. So 5, maybe you read a book, or 80, you read a book. So 0 is know nothing, and 10 is a practitioner. So we got some practitioners, we have some newbies here, people in between. Thank you for putting that in the chat. We got some middle roaders, some people who want to go from a 9 to a 10, I'm supposing. Okay, that's great. That's great. Okay, thank you for putting that in there. I want to start out with two personal stories of my experience with logosynthesis. And the first story is my first contact with logosynthesis. Let me grab this book. And it was through this book by Larry Weiss, and it's a self-healing tool book. Logosynthesis can be used as a self-healing tool as well as used with a practitioner. So this was my first exposure with logosynthesis, was using it on my own. And I had an issue I wanted to heal. And my issue was I had 4 grandchildren that had just moved from Utah to Georgia, which meant I had to go on a plane. And my problem is that every time I went on a plane, I threw up. And I would just arrive, just not feeling so great with all my energy gone. And so on my own, by using Laurie's procedure, I was able to overcome air sickness. And I've not gotten sick on a plane since 2019. And so I was so fascinated with my own results that I called Laurie and made a one-on-one appointment with her. And we did some work on a relationship issue that was stressing me out. And I had such an increase of confidence that stayed with me for a long time, and just some really positive feelings and some positive thoughts that, I just felt that real change that 2 weeks later, I actually enrolled in a class with Dr. Lammers, and that started my journey as a logosynthesis practitioner, which I wasn't planning on the time, but I was just so fascinated with the curriculum that I stayed on that track, and here I am. So the second story is one of me working one-on-one with a practitioner with concerns about my chronic pain. And for years, I had suffered with back and neck pain, and became worse. The hardest time was after I'd had my sixth baby, and I had a lot of back pain, and it took me about 3 years to overcome that. And at this time, my back pain was kind of coming back and creeping back into my life, and it was causing me some anxiety and worry and fear. And so I thought, I'm going to work with a practitioner and we're going to work on this, which I did. So when you work with a logosynthesis practitioner, what they're looking for is a trigger. And triggers are something that you can see, like an image or a sensation or a memory, or a fearful fantasy, or a limiting belief that make you feel stressed out. And identifying these triggers is central to logosynthesis. And this is one way that logosynthesis differs from traditional psychotherapy, where the focus is more on emotion and story. So, as we explored this together, this chronic pain I was experiencing, an image emerged. And it was me pushing my baby down the hallway in a stroller. And this is what I had to do. for a long time because I couldn't walk and carry her at the same time. So I put her in the stroller and move around the house. And while we were processing, something happened. The pain intensified sharply in my body just for 3 seconds. And as quickly as it came, it released. And at the same time, a new image emerged. This one. Instead of a painful struggle, a playful image come to mind. And this really brought me some really fascination. I see myself running down the hallway instead of in this painful stance. And this was really unmistakable that my body was communicating to me that this is different. You can heal. Let go of the fear. It was a powerful emotional realization for me, and I could heal again. And the panic and the worry were gone. And logosynthesis makes possible this kind of change. And I've witnessed this. I mean, this sounds kind of maybe a little fantastic or interesting with the image, but this is really quite universal experience when you work with logosynthesis. Something always changes, although how it changes in form and intensity is personal and unpredictable. So today I'm bringing together chronic pain and logosynthesis. And pain is a universal human experience. We all experience pain. But here's what research makes very clear. Not all pain should be approached the same way. If you want to spend more time living your life and less time in the waiting rooms, one distinction matters. And that is this acute pain or chronic pain? And when this distinction is missed, people often make big, costly mistakes. And there's four critical mistakes that people make when dealing with chronic pain, but today we'll just touch on the first one. So this is the first critical mistake that people make when treating chronic pain is treating it the same as acute pain. And when this happens, research shows that people cycle through repeated doctor's visits, procedures, and emergency rooms, and many struggle with narcotic addiction and limited relief and increased risk. And this is why understanding the differences is so important. And for the purpose of this presentation, I'll focus on just these two differences, and there's at least 10 of them. But we'll just do on these two. So there's structural differences and what's happening in the brain. So an acute pain is pain that usually is tied to a clear injury. And here's some examples. And this is often treated with medications and surgery or physical therapy, and in 6 to 8 weeks, this is healed. And chronic pain is different. It may or may not have a clear cause, like an injury, but the pain continues even when the tissues have healed after the 12-week mark. And here's some examples. For some, this is constant, and for others, it comes and goes. So I was talking to a friend who was suffering with some migraines on and off, and she'd had it for years. And through our conversation together, she realized that she was actually in this pattern of chronic pain, and she hadn't realized that before. So it's an important distinction to also understand this 12-week and the cycling issues with chronic pain. So the second difference between acute and chronic pain is what's happening in the brain. And this is research that I absolutely love. This research shows why chronic pain requires a completely different approach than acute pain. So researchers studied clients with new back pain, and some recovered and others didn't. Some went into chronic pain. And they distinguished between these two groups of people not by looking at their bodies, but by looking at their brains. So when acute pain resolves, the brain calms down too. And this scan looks normal. But when the pain persists past the 12-week part, then the brain stays hot. And these hot spots mean heightened brain activity. And this tells us something very crucial. Chronic pain isn't just experienced in the body, it's being generated and maintained by the nervous system. And that's why some researchers call chronic pain a mind body syndrome. It's not because it's in your head, but because the brain has become stuck in a danger signal loop. And this leads us to the most important takeaway. The number one treatment goal of chronic pain is calming the central nervous system. And this is why my most important work with my clients, my chronic pain clients, is to help them to calm the central nervous system. And I'll share 4 ways today that I use logosynthesis to help my clients to reestablish calm. So the first one is the power of observation. Most people don't take the time to observe their bodies, let alone stop and do something about it. And chronic pain research tells us that when a person learns to observe their pain and their bodies, then their bodies and their brain will stop yelling so loud. So here's a game-changing research from the University of Colorado. They studied people with chronic pain. They put them in 3 groups. The first group was a mind-body group. First group learned how to observe their pain. The second was a placebo group. They got saline shots. And the third group was traditional. They got anti-inflammatories, physical therapy, and pain pills. 4 weeks into the study, this mind-body group who learned to observe their pain, 66% of them were nearly pain-free, compared to the placebo group at 20 and the physical therapy at 10. And a year later, they studied this mind-body group again and found that 98% of this group pain-free. So what this tells us is that if we want to heal, we must learn how to observe. And when I work with Logosynthesis clients, I ask them what is going on in their bodies, whether they are suffering with chronic pain or not. Because no matter the issue, what's going on in the body reveals important information about what's being held mentally, spiritually, or emotionally. So I focus on developing autonomy with my clients and created an observational training tool, a meditative exercise that helps them to learn this pattern of observation. And it's called BOBUD, after my favorite drink. And it stands for break time, observe, big breath, ask, and do. And I want you to experience this power of observation for yourself and see what happens in just 4 minutes. So make sure your mic is muted and you can change your screen to avatar if you like, but just make sure you come back so I can see your faces. And this will be easy. Just follow the sound of my voice. So get into a comfortable position. And I'll start this 4-minute meditation now. Welcome to BOBUD, your opportunity to observe. When you feel pain, discomfort, or tension, these are observational opportunities. You can use this protocol to reteach your body and brain to simply observe. This creates calm and lessens pain. Let's begin. B, it's break time. Start your break time by getting into a comfortable position and taking a few deep breaths. Breathe in deeply through your nose and out slowly through your mouth. Allow each breath to become full and relaxed. O, observe. Observe your body and notice any areas of pain, distress, or tension. Now focus in on one area and breathe deeply. Draw a mental circle around this area and observe it with calm curiosity and self-compassion. Remember, you are not in danger, so just observe what is there. B, big breath, shimmering body. Take a big breath while visualizing a shimmering space surrounding your body. This is shimmering, bubbling oxygen, ready to restore and to heal. Just sit in this space. Feel how the oxygen enters through the nostrils and swirls towards and around your area of focus, flooding all edges and inner layers with bubbling, energy-rich oxygen. Inhale swirling oxygen in and exhale tension and toxins out. Inhale oxygen in. Exhale tension and toxins out. Inhale swirling oxygen in. And exhale tension and toxins out. A. Ask and answer. What can I do to calm my central nervous system, or what does my body need right now? Pause this audio if you need more time. D. Do and done. Take a deep breath and reflect upon your answer. Start to gently move and wiggle your body. Take another deep breath and open your eyes. Look towards all four corners of the room. Whatever your answer was, this is your next thing to do and to be done. This is the end of BOBUD. Let your observations guide your next steps as you return to your day and create your great. May you be blessed. All right. So you can come back now. Would two people like to open their microphones and just share what happened to them during this observational meditation really quick? Go ahead.
Are you able to hear me okay?
Yes, thank you.
Uh, Hi. First of all, that was super relaxing.
Good.
I deal with a lot of chronic pain in my gut, like stomach area. And so I noticed like actually observing and slowing down, there's like this intense pressure under my ribs. And first calling attention to it, I noticed it was like spiking along like with my own anxiety, like focusing on it.
Hmm.
But then shifting to like the glittering like oxygen after like envisioning that with a couple breaths, I noticed that like even though I was still feeling the pain, it was less sharp and my anxiety was like decreasing. So I
Awesome.
definitely noticed a shift with that for sure. It was very cool.
Great. Thank you.
Mhm.
Would one other person like to share?
Hey, Mary, I'll share.
Yes, thank you.
So so there's a place that I go within my mind usually for meditation, and this one took me to a new place I haven't been before, which is interesting. And just asking that question of what does your central nervous system need, which is something that I haven't even thought of asking myself before, um, brought an answer that I should have realized and known, but hadn't thought about. And so it was very interesting to have that happen and then have my mind, because I'm an overthinker, add all sorts of other stuff after that. But going back to that first answer, it was very soothing and calming, and definitely a place to help calm that nervous system, as you mentioned.
Great. Okay, thanks for sharing. I appreciate that. So a second way I bring logosynthesis into my client life is to share power principles with them. Dr. Lammer says this: use elegant principles and beliefs in your life, and you'll be much more powerful. And one of those power principles is this: your body is your instrument for your mission. And this concept deeply resonates with my chronic pain clients who are being challenged with their bodies. When we understand that the body is an instrument for your mission, then managing our body and our energy matters more. Pain is not just something to endure, but it's information, a signal that something needs to be healed. And sometimes pain gives you information about these issues. And these can be held in the body as chronic pain. And when When these experiences are acknowledged, then healing shifts from coping to creating lasting emotional wellness. And when you experience this type of healing, this is where the body not only serves as an instrument for your mission, but also serves as an instrument for healing. And if you're challenged with any of these issues, contact one of our practitioners. Most of us work online and get on to healing. The third pivotal way I bring logosynthesis to my clients is to help them use the tool of logosynthesis to release limiting beliefs that are stopping them in their healing. And we're going to do a demo in just a minute where you will process a belief with logosynthesis. But why this is such a serious matter, chronic pain, is because research has showed us that there's a direct relationship between improving your beliefs and lessening your pain. And in a related study by the Brazilian Journal of Physical Therapy, they found that what someone believes about their musculoskeletal pain directly influences how well the physical therapy works for them, how much ability they regain, and what level of disability they maintain after treatment. They found beliefs to be so pivotal that this study recommended starting a client's physical therapy treatment not with the movement part of therapy, but with the mental part of physical therapy, first examining their beliefs towards the pain and the treatments. Beliefs lead to actions, lead to outcomes. And the outcomes we're talking about here are less pain and more ability. And we know that if we have strong beliefs, that we don't spend a lot of wasted time, energy, and effort, and we can get to better outcomes. So here's 4 ways that you can manage beliefs. And I call them limiting beliefs because they limit you in your healing. The first way is to suppress it, and this is often referred to as positive suppression. And this is a bad way. We just cover up whatever's going on with positivity, and this doesn't work long term. And then we can reframe it, write in a new story. This takes practice and repeated rehearsals, but it might work for you. Push through it. This is stoicism. This takes consistent mental effort and stamina. If you've got great mental management, and this can work for you for a time, or you can process it with logosynthesis. When you process with logosynthesis, you use the power of words to get unstuck, to move energy, and to change things in real time. It may sound strange to expect the power of words to move energy, but if you've ever read a good book that's motivated you to change, or you've stopped at a traffic light, or you've been influenced by an advertisement to buy something, then you've already experienced the power of words. So I want to give you an opportunity to experience this by processing a belief. So here's a list of beliefs, and I want you just to look at this list, admit, and choose one that feels true for you. It's can cause some type of reaction or tension in you. Don't overthink this. I'm an overthinker too, but don't overthink this. You don't need to choose the biggest belief or the perfect one, just one that brings a small sense of tension to you in your body or in your mind, one that stands out. And give me a thumbs up. I can see only see a few of you, but give me a thumbs up when you have chosen this belief. Okay. I see one thing. Thank you. Okay. And then I want you to not, you don't need to analyze this in any way, but I do want you to score it. So on a scale of 0 to 10, I want you to score how distressing this belief feels to you. So let me find my scale. 0 is no stress, and 10 is the highest level of distress. So just write this down or mentally note it. This is a reference point that you'll use later. So give me a thumbs up if you've got a distress point and your belief shows up. Okay, great. Okay, we're going to start. Your computers are muted, and those of you who are new to logosynthesis, I want to explain just really quick what we're going to do. We're going to do 3 sentences. There'll be a pause between each sentence where you can process. And when I say the sentence, then you repeat after me. And during the process, just observe what's happening for you as if you're a lifeguard, just watching yourself float around in the pool. You don't want to overanalyze or try to force any change. Just allow for a shift to happen. So if any point your mind wanders, that's okay. Just gently bring your attention back to my voice, and you're going to repeat the words that I say. As we begin, take a moment to get yourself comfortable. Place both feet on the floor if you can, and allow your body to settle into whatever position feels supportive. Let your hands rest easily and allow your shoulders to soften. Close your eyes if it feels comfortable for you. As you think about this belief, I want you to notice your body. Are you experiencing any tension, pain, or pressure? If so, where is it in your body? What's its intensity? What's the specifics of how it feels? What related emotions are coming up for you? Fear, sadness, guilt, grief, anger? Now focus back on the belief by simply saying it out loud in this way. This belief of, and then say your belief. So this belief of. Take one slow breath in and a gentle breath out. Repeat after me and say this out loud. I retrieve all my energy, bound up in this belief of, and then say your belief and take it to the right place in myself. And then you'll have a pause to let the things process before I go on to the second sentence. So that was your practice. Now we'll start. Repeat after me and say this out loud. I retrieve all my energy, bound up in this belief of, and say your belief, and take it to the right place in myself. Just relax and let the words do the work. Repeat after me. I remove all non-me energy related to this belief of, and I remove it from all of my cells, from my body, and from my personal space, and send it to where it truly belongs. Just let the words do the work. Repeat after me. I retrieve all my energy, bound up in all my reactions to this belief of, and take it to the right place in myself. Just relax and let the words do the work. Open your eyes now and take a minute to acknowledge what has happened for you. Something always changes with logosynthesis, and it can be stark or subtle. So just observe and notice what is happening for you. If you have water near you, take a drink. I want you to give this belief a new rating. 0 means no distress, and 10 means the highest level of distress. I'd like you to write in the chat. Actually, I'm going to have you open your mics. If a few of you want to give me how your scores changed, like say a 6 to a 2 or maybe it went up. Hopefully not.
Hi, my number
Yes.
went from 4 to 1.
Awesome. Thank you.
Yeah, thanks.
Because of time, we're going to move on. Thank you for sharing. I hope you all had a positive experience with that. And before I go on to my last point, I want to share this slide with you. If you want to scan this code or write down and go to my site later, or just scan this code with your phone, you can get a free copy of the boba meditation that we did on an MP3. And then I also have this Anatomy of Beliefs book where you can learn more about beliefs, how they shape your life, and how you can get unstuck from beliefs. So I'll leave this up for a minute. And I have one more point I want to make, but I want to leave a little time here for questions. So I'm just going to ask if people want to open their mic, if they have any questions about what you've experienced today or comments. If we have time, I'll show you this last demo, which is a 5-minute video, but we'll see how the time goes. So any questions about chronic pain or what you've experienced today with logosynthesis or any other questions floating around your mind, please open your mic so I can hear you.
Is it okay if we use your Bobot meditation with our clients?
You bet. Yeah, you're welcome to do that. It's on
Thank you.
MP3. You can share it with them. Yeah, enjoy. Any other questions?
Apart from working on limiting beliefs, what else do you focus on with clients suffering from, for example, neuropathic pain, severe neuropathic pain?
Well, let me tell you what we're going to do next then. One of the things I do is I guide people through a 21-minute meditation. This is not available publicly. It's in my chronic pain course, but it helps people to calm 3 pain areas in 21 minutes. In my experience, it's all about calming the central nervous system. And any way you can do that to chronic pain clients is going to be effective, whether it's through hormonal training, getting those endorphin rushes by doing weight training, or calming the system by bringing in more dopamine, settling in with serotonin, getting more sleep. Anything that calms the central nervous system is going to be beneficial to your clients. And chronic pain is a multifaceted requirements. There's lots of practitioners that need to be involved, starting with a medical doctor who rules out other problematic issues, or maybe a pain specialist. Logosynthesis practitioners, I would certainly hope, because they're so powerful, but there's also, physical therapists, massage therapist, or a chiropractor. There's so many different modalities that can be incorporated. So it's really a multifaceted approach to chronic pain that's required, all with the same goal of calming the central nervous system. Does that answer your question?
Yes, thank you. I'm a
Okay.
hypnotherapist, and my therapy is that I teach my clients also to use hypnosis, small, maybe twice a day, just for 5 minutes or maybe 10 minutes, in case of chronic pain. Do you teach your clients to use themselves logosynthesis to influence their pain level?
I do. So I take them through the limited beliefs we talked about, that meditation we talked about. And let me show you this since we have 5 minutes left, I'm going to show you this demo of what I take them through too. This is part of my chronic pain course, but it goes through my adventure begins. This is a different story. We're not going to do this one today. And I have this powerful meditation that incorporates logosynthesis, and it gets rid of the 3 pain areas in just 21 minutes. So I'm going to do this demo, and we'll maybe get cut off at the end. What are the main kind of pains that you're dealing with right now? And this particular will focus on 3.
My primary thing I've been fighting in terms of pain for years now has been in my lower body. I've got several injuries that have occurred over the years, but the pain points, both my ankles, my right ankle doesn't have an Achilles tendon, so it doesn't move very well. And then my left ankle, which should be my good ankle, has had 2 surgeries. There's a pin in there, and there's something wrong with it that I just can't walk right. And a lot of times I end up limping from the pain, physical therapy, and different attempts to treat it for a couple years now, and I just haven't found any relief. So that's seems like the limping and whatever's going on my left ankle has caused my left knee right beneath the patella to just start throbbing. I have a hard time bending it, kneeling down, putting pressure on it. So that's weird. I can't quite figure out why it hurts, because if I kneel on it, like the initial bending down to kneel hurts, and then all of a sudden, once I'm kneeling, I'm fine. So I think, in terms of 3 things, that left side and that chain, however they're interplaying with each other, is probably my first and foremost chronic pain issue. But all of those have been going on since 2014, 2013.
So right now, what number would you give your right ankle?
Right ankle is at about a 2.
Okay. And your left ankle?
I'm sitting, it's fine. If I stood up on it, it's about a 4 or 5.
Okay. And then your left knee?
Left knee, just sitting here, it's about a 3.
Do you want to stand up and see what it feels like?
I mean, in the process of standing, my knee goes to about a 5 or 6, and my ankle, left ankle, jumps up to about a 5.
Okay. So let's do a 5 on your ankle, because we'll have you stand afterwards.
Okay.
5 on your ankle, and then your knee. What do you think on your number?
5. Yeah.
5 when you stand.
Yep.
Okay. And your right ankle, does that make any difference if you're standing or sitting?
No, it's just always kind of a low grade pain.
Okay. And just take a minute and see what you're experiencing and what you're noticing.
I think any pain in the right ankle is completely gone right now. I don't feel anything.
Even with standing?
Yeah. My left knee still hurt when I stood, but it wasn't as bad. Probably it's just like 2.
2?
And I don't feel any pain in my left ankle sitting, which was the same. And then my left ankle standing, I'm feeling nothing to 1 or 2. I mean, I don't really feel anything, so probably nothing. Just a few things to mention to you that I thought were interesting. Right when we started, the muscles just to the left of my belly button just started spasming like crazy. And I don't know why. I haven't had those muscles spasm probably ever. So just thought I'd mention that to you. So I don't know what that was all about. The second thing is, when we were exploring the right ankle, there was some pain that I hadn't really registered before on the outside of my ankle, not even near my Achilles tendon. And then on the left side, I had a really hard time separating the knee and the ankle. When you told me to put a soft zone, or however you phrase that, around the left ankle, I just hardly could do it. I couldn't mentally surround just the left ankle. The knee was just like hollering at me from up there, and it just wouldn't stop. So I just wanted to share that with you. I don't know what that all means. There you go.
And the belly thing, I don't know how to interpret that. And we talk about, oh, I had a feeling in my gut. It's just a gut feeling.
Yeah.
I think there's a huge significance to that,
Yeah.
And there's different parts of our body that talk to us at different times. So, okay. So on the conclusion on your numbers, then your right ankle's at a 0.
Yeah.
Your left ankle is at a 0, even with standing.
Yeah.
And your left knee's a little bit going on at a 2. Is it still throbbing?
No, it's not throbbing. It just has a slight pain sitting here. And then when I stood, there was still that more acute pain, but it wasn't as intense. Honestly, I'm pretty happy with where it is. More often than not, I'd be sitting here ignoring it, and it would be throbbing. And right now, when I focus down on it just to look at it, see what it's doing, there's not much pain there. It's kind of sitting there. In that standing motion, there's still some sharp pain, but it's not extreme. It's lower than it was. I'm pretty happy with where we're at.
So just calming the central nervous system is really, really essential. So if I can help you out by giving you this Bobad meditation, please get that. If you're interested in the ebook, this comes in one package. So thank you for being here, everybody, and enjoy your day.